Welcome back to Intrepid Healthcare. I'm your host, Joe Lavelle, and I'm really looking forward to this conversation about a transformational healthcare company that is working hard to ensure the safety of medications. We're going to get right to it today. Today we're joined by David Prokop, founder of TruMedicines. David, welcome to the show.
Thank you for having me.
Oh, thanks for making the time to be with us. Before we begin our discussion, could you take a few seconds, tell the audience all about you and your background?
Well, I've been a computer scientist for the last 16 years, and I've been working specifically in the area of computer vision systems. And I've been working directly with the Xbox Connect product, where we use camera systems in a computer to identify people, their faces, and their body movements. So I've been very interested in that technology for a number of years. And so I use that particular technology for my new venture, TruMedicines.
Great segue. Could you take a couple of minutes and provide our audience with a 10,000-foot overview of TruMedicines?
TruMedicines is really a groundbreaking type technology where what we are able to do is identify individual pills that people have using the unique pattern of granules in a tablet. And so I'm talking about little colored speckles in a pill. And when you look at it with a computer vision system, it's able to identify that tablet as a particular drug. It's almost like a fingerprint for that particular pill. And so using the system and a smartphone, we're able to tell people about that medicine, saying this is a drug you need to take 2 times a day, you need to take it with food, and you can't use it with other drugs to be sure that a person doesn't get an adverse reaction from other drugs taking it. So we think it's going to be a very easy-to-use system using a simple cell phone. Take a picture of the drug, and it will tell you everything you need to know about that drug.
Wow. Let's start with the topic of compliance regarding medications. Is this something that you're helping with, and is it a real problem?
Compliance is actually a long history of problems in medicine, actually. It actually goes back almost 2,000 years to the Hippocratic Oath, where it talks about how doctors need to perform the care for the patient, but the patient also has to cooperate. So I think the word cooperate translates nowadays into taking your medicine. And so what we hope to be able to do is to incentivize people to scan their tablets and to give that information back to their doctor or their insurance carrier and helpfully reduce the price of their insurance premiums, or help the doctor understand that they are taking their medication and they are trying to improve their health. So we think our system will be able to help with compliance tremendously over what's been happening in the past. It's such an easy-to-use system that we think a lot of people will be able to use it just for their own information. So when they scan the tablet, what happens is it goes up to our database, identifies the tablet, and brings back down a picture of that tablet, and it provides text information, how to use the drug and so on. But the really fun part about it, it uses text-to-speech, and it actually announces how to use that drug to the person in the language that they're native speaker. So we can do it in Italian or French or Spanish, and it will describe to the person what you need to do with that drug. So this becomes very handy for elderly people or people who just don't take the time to read the back of a small print of packages. So they can scan the drug and it will tell them when to use it, why to use it, and how to use it. So we think that's a user-friendly scenario for people who just don't like to read the small print on packages.
So imagine it also helps those that might be confused whether they have the right pill or the wrong pill, maybe somebody who is advancing in age, and probably as well identifying people that are trying to cheat to put illicit drugs on the market?
Yes, Joe, you're absolutely right. When you can identify a tablet, typically what happens when the pill is separated from the packaging, you lose all information about that pill, and you have really no idea. And so if you keep your pills in those little pill boxes, you can have 3 or 4 in there, and you really don't remember what each one of those pills do. And so using our system, you could identify which pill is which and which ones to take, and maybe you're stopping to taking one of your pills. And we can also provide this service as a method of compliance with your drug regime, but identifying counterfeit drugs is not a big problem here in the United States. But in the rest of the world, in Africa, in India, the counterfeit drug is a $75 billion criminal activity that is rampant in some of these other countries. And so we think this is going to be a big plus for people in those countries to be able to check their drugs and identify what's a real drug and what is a fake drug. And it's extremely important for people in those countries.
Wow, the use cases, just seem like there's many. What was the original one? What was your inspiration? How did you come up with this idea to start TruMedicines?
Well, I had been reading recently about the problem of counterfeit drugs in Africa, and I read the story about a parent who was a poor person who was looking to get malaria tablets for their child. And I was reading that the problem that the parent faced was they had only a certain amount of money to buy one package of this malaria pills, but they weren't sure if this malaria pills were a counterfeit or were they real. And it was an important decision for this parent because the child could die. So it was a life or death decision for this parent. And I felt, having 3 kids of my own, I realized that this parent is in just an awful situation to have a limited amount of money and has to spend this money on something they're not really confident is going to work for them. And so after reading that story and thinking about it and really trying to put myself in that position of that parent, I had sitting on my desk a bunch of breath mints and I had actually knocked them over onto the floor during this article because I was sort of angry at the situation here that it seems so unfair for this person to make this decision. Anyway, when I was picking up these breath mints, I noticed that each one of the breath mints was speckled and had little spots on them. And as I stared at this pill, I realized we could use face recognition on this tablet to identify this pill. And I started working on that assumption and was able to secure a patent for that process. So now we have it in our software, and we can now use a smartphone to benefit the pills. And it all gets back to that scenario of that parent having to make that awful decision. And using our software, we think we can give that parent the power to identify what's a real tablet and what's a fake tablet. I mean, he'll no longer have to make that terrible decision about their kid's life.
Wow. As I sort through the different use cases in my mind, I find myself wondering, who is your customer? How do you go to market?
Well, what we do is we use this 2-stage authentication process where someone will take a scan of the barcode on the packaging and then take a picture of the tablet. And so we're approaching companies, drug manufacturing companies, as well as drug packaging companies that will put the barcode on the packaging and then we'll be able to save the image of the tablet. So we're looking at drug manufacturers, we're looking at wholesale distributors of drugs, and we're looking at also the distributors that provide medication online. We think that the online service is a valuable tool for the future. We think that's a growing enterprise. But the problem with buying drugs online is you're never really sure when you get them home if they're authentic or not. And so we think with our system, we'll be able to make assurances when people buy something online cheaply that they'll be able to be sure that this is the right drug at the right strength and the drug that their doctor requested. So having that ability, we think we're going to enable the online pharmacies to start selling secure medications, and we think that's going to actually be the cheaper way to buy drugs in the future, getting them online or through mail order. It doesn't have the overhead cost of pharmacies and things like that. So we think that we'll be able to help the online buying of drugs, which a lot of older people do nowadays, looking for drugs that are generics. And so typically those are sold online cheaply.
With that, Intrepid Healthcare will return with our guest, David Prokop, after this quick break. And we're back with David Prokop, founder of TruMedicines. David, I understand that you feel there's a big opportunity for big data at TruMedicines. Could you tell us how and how TruMedicines is using big data?
Yes, it's going to be another just boon to the public health industry, where what we're able to do using a cell phone is when you scan your drug packaging and your tablet, we take the GPS coordinates of your phone and we bring those up to our database, and we're able to provide a map of where drugs are being scanned and where drugs are being sold in a region. And so public health people could then look at a map like this, a live data map, and see if, for instance, a flu is becoming a real problem or an epidemic in an area. And so they can go to a school or they can go to a particular location and they can help people try to control that flu virus that is running through the community. So we think this is really going to be a powerful tool for public health officials to be able to spot early on when there's an outbreak of flu or some other disease like that, because they can use the GPS coordinates to identify the proximate area. And we'll be able to provide that information while taking out any personal information. We'll be able to scrub out any information about the person's cell phone and just provide the data coordinates to the healthcare providers. And so we think that's going to be very helpful for the public health system to be able to identify regions of where the flu outbreaks or other outbreaks of other diseases are occurring.
Perfect. One of our audience's favorite questions, what can we expect from TruMedicines in the next 6 months? What are you working on? What will you bring to market over the next 6 to 12 months?
Well, right now we have successfully completed our alpha phase of our software. And what we're looking to do is roll out our system into a beta phase or a clinical study. So we want to give the software to patients, and we want them to give us a feedback of how we could make that software better and more user-friendly. And we're hoping to get, within 6 months, a clinical trial of that software. And we hope to have this all out into the public and on some Schedule II drugs within the next 10 months. We hope to have the Schedule II opiates as well as some of the drugs that take care of schizophrenia. I know another problem that people face when they have children that have schizophrenia is that often these people don't take their medications when they should. And then when they don't, they can get into all kinds of troubles. And so parents have to monitor their kids by asking them. And of course, they don't always get the truth. But if they are able to scan their drugs and you have that person scan their drugs, they're able to stay compliant on their drug regime. And so the parents have a more confidence, at least, that this child of theirs is able to stay on their drug regime and will be able to function normally. And I think this is a tool that people haven't had and they've needed for a long time. And so we hope to provide that tool in the same 10-month period that we're putting out other pharmaceuticals.
As you left your role at a big software company and decided to start this company, there must have been lots of challenges. Some you expected, some you didn't expect. What are some of the big challenges you're facing now that you would have never expected?
The big challenge I face is that here in the United States, the idea of counterfeit drugs is not a big issue. And so I've had to do a lot of explaining of what's happened. I have worked in the Middle East and I've worked in Africa, and I know the challenges that those countries face. And so when I'm here in the United States and I'm telling people about the counterfeit problems, I really don't get a big response. I know that people just don't really know, and so it's hard for me to really communicate those kind of problems. What I think is more interesting here for people in the United States is the compliance issue. And then I can provide direct results of compliance where we can reduce healthcare costs, or we can monitor your mom's diabetes medication or your son's schizophrenia medication, and people have this level of control over who's taking what and when. And when you're able to have more control of your own medicines, we think people are going to be healthier quicker, and we think we can provide that service to people cheaply. And so that's what we're looking forward to doing. And I think when I tell that story to people in the United States, I get much better response than the idea of counterfeit drugs. So I'm excited about those cases where you can take control of your medicine and understand why you're taking these drugs, and then link up with, for instance, social media like Facebook. And on Facebook, they have these forums where people who have diabetes can go up there and find out more information from people who are diabetics, so they can link up to their people that have the same problems that they face, and they can read about how other people in the community have solved some of the problems that they're facing. And we think that's going to be another big win for people with, say, diabetes, and they'll be able to get more information. So it's sort of all about delivering information to people quickly and easily with a lot less fuss and muss that they've had to dig through in the past. We think we can deliver that information easily over a cell phone.
Got it. Do you think that you'll start with the common chronic conditions first? You mentioned the Schedule II drugs, things like diabetes, things like obesity or heart conditions. Will those be easier use cases to get to market, do you think?
I would like to focus on those chronic conditions because they're just epidemic here in the United States, and those, I think, are critical for us to address as a healthcare system. So some of the biggest chronic conditions we're having in the United States is diabetes and is hypertension and coronary heart care. And so I think we were going to focus on those big problems first, and we want to get inroads into helping people manage their medication in diabetes. And we want to get to the point where in diabetes it can be a progressive illness, and it can get progressively worse if you don't take your medication, and you can get amputations and other complications. And so if we can provide a tool where people can stay on their medications and not have to face those complications in the future, everyone's going to be a lot happier. That, for instance, I'm able to have access using the HIPAA regulations. I could look at my mom's compliance records, and I can see when she's been taking her drug, and then I can get notifications that say that your mom didn't scan her drugs for the past 2 days. And I can then give her a call, and I can find out what happened. Is there a reason why? Did she run out? Or is something happening that she's not compliant? So I think that provides a level of control and security for people who care about their loved ones who are on medications, and they want to make sure that they don't get into these complications that can require surgery or other problems. So we're going to hit those big ones first. Diabetes, we're going to hit hypertension, and coronary heart care as the big problems we want to impact.
Perfect. We're running a little bit low on time here, David. Before we let you go, where can people go to learn more about TruMedicines?
We have a website. It's TruMedicines, TruMedicines.com. And up there we've provided some videos that show people how to use their cell phone to be able to identify their drugs. We're providing that in a couple different languages, so we think that's a helpful resource. We also have some videos on YouTube that helps people understand more. And then we have a Twitter account also, so people on Twitter can send us messages, and we'll be happy to respond that way to give more information about TruMedicines.
Great. David, it was a great pleasure having you. We'd love to have you back and hear about your progress in 6 months or so.
Great, Joe. Well, thanks for having me.
All right. That wraps this broadcast. On behalf of our guest, David Prokop, I'm Joe Lavelle, and we'll see you soon on Intrepid Healthcare.